Pregnancy is an incredible phenomena. All that is needed are a sperm and an egg. Women have a uterus and 2 ovaries. Every month, one of the ovaries releases an egg which travels down the fallopian tube towards the uterus. This is called ovulation. That's when a woman is most fertile and can get pregnant, which can be up to 10 days every month. Sperm are created inside of a man's testicles and are released during sex when he ejaculates. During ejaculation, about a teaspoon of cloudy liquid called semen containing millions of sperm comes out of the penis and enters into the vagina. The sperm travel through a woman's cervix, into her uterus, and up the fallopian tubes, searching for an egg. Sperm can live up to 7 days inside a woman's body. The first sperm to come into contact with the inner layer of an egg will be the one to fertilize it. Once a sperm enters the egg, conception occurs. At that exact moment, an amazing thing happens. A brand new, unique formation of DNA is created. DNA is the intricate instruction manual that makes each of us different. No 2 people have the same DNA, and it all starts at conception. What were once an egg and a sperm is now a genetically complete human being, which doctors call a zygote. Immediately, the hair color, eye color, blood type, and hundreds of other characteristics of the zygote are determined. Even the sex, whether it will be born as a boy or a girl, is chosen, although the genitalia won't form until later. The zygote travels towards the uterus where a spongy, cushioned lining made of cells and blood vessels has been prepared. The zygote attaches itself to the uterine lining and is now called an embryo. These different terms are used as a measuring system. Just like the terms infant, toddler, adolescent, and adult are used after a person is born, the terms zygote, embryo, fetus, and baby are used before a person is born. The embryo attaching to the uterine lining is called implantation. The lining gives the embryo the nourishment it needs to continue developing. As soon as implantation happens, the uterus sends signals to the brain that pregnancy has occurred. The brain causes the ovaries to continue producing a hormone called progesterone, which keeps the thick uterine lining in place so it can nourish the embryo. Now that the embryo is implanted and receiving everything it needs, it continues to grow and mature. Just 21 days after conception, the heart starts to beat. That's often before a woman even knows she's pregnant. If a sperm and an egg don't meet, the egg along with the uterine lining are flushed out of the body through the vagina. This is called a menstrual period. It can take a few weeks before symptoms of pregnancy show up. Common symptoms are missed period, tiredness, nausea or vomiting, tender swollen breasts, and mild pelvic cramping. If you have questions about pregnancy or think you might be pregnant, it's always a good idea to talk to your healthcare provider.